Okay. There's a question in the back. Okay. I'm sure no one heard that except me. Did everybody hear that? People in the back heard it? Okay. Well, let's repeat it. Why do chronic pain patients kill themselves? I'm assuming you're not a chronic pain patient, you're a caregiver? Okay. Well, that's a long discussion. That can be a long discussion. I'm going to answer it. But there's lots of aspects to that. Statistics, sleep problems, drug and alcohol abuse, neuroscience, pain meds, lots of aspects. But I think it comes down to one thing. The same thing that happens when anyone commits suicide, and that is loss of hope. Suicide is seen when people lose hope. Chronic pain patients have a little higher incidence of losing hope. There's a great deal of loss in life, and when life just feels like tomorrow is going to be more painful and there's no redeeming qualities and there's no hope, when life is full of fear of pain, fear of more loss, sadness from all the regrets and all the loss, and you don't have enough support and you don't see a future and you lose hope, that's when you see suicide. I know of 3 patients that I lost. None of them was I around at the time, because the first one I had commit suicide, and there were some overdoses that are questionable, a couple, but this one was left a suicide note. That person, 2 months before, the workman's comp people had denied her claim. She had stopped coming to see me, and with the medicines that she had left over, she killed herself. I also had 2 arachnoiditis patients that when I moved my practice 100 miles away, their workman's comp carrier also told them that they had to pick a local doctor, and they changed all the medicines, did some injections, and well, they both committed suicide within 6 months. And I have some guilt over that, because I didn't provide a way for them to get to me. Maybe. I mean, one of them had contacted me about that, so. But it was loss of hope, and dealing with the fear of tomorrow being more painful and worse. And all 3 of those patients had been stable. So, regret can bear down on you. You can lose hope. Tomorrow can just seem more painful. I don't think it's any different than other people. Some people say, oh, it's because the medicines are around. Well, there may be a little about that, because if you have the impulse and the medicines are there, but you can go to the corner drugstore and get Tylenol, and I think that's the highest suicide rate. At least when I was working in the hospital, the suicides we saw were a lot of them were Tylenol. Now it's probably changed. As far as accidental overdose goes, I think that can occur. I've seen that especially with treatment changes and or people not under control with their pain and them trying to self-medicate. But for suicide, why do chronic pain patients kill themselves? Because they lose hope. They fear tomorrow. They hate today. And they don't see anybody helping them. They don't see support. So get people, reach out your hand, get people into support groups, make people feel supported, check on people. Sometimes when they get quiet, that's right before when things go bad. And as far as physicians go, screening with drug and alcohol abuse, because that's a good sign that there's things that are going the wrong way. Screening for drug abuse, depression, anxiety. Remember, depression is sadness. It's sadness of loss, of all you've lost. Anxiety is usually fear of everything that's gone wrong and can go wrong more, and the pain. And anger is coming out of those 2 things. When you're sad and you're fearful, what do you think you do? You get angry. So look for those emotions, and as they go up, or as people get quiet, those extremes, that's when you sometimes see the worst outcomes. So, did that answer your question? All right. Well, we're going to talk more about mood disorders in the next caregiver support meeting. So, it kind of ends it on a downer, but I think it's a real important subject. And get out there and, as caregivers, provide hope.